So now that I have a couple minutes in between my middle of the day, the new days are 6 a.m. to 11 p.m. I told everybody I would do a just a little bit of informative video on heat-based therapies. And heat-based therapies, there are many of them, and these range from lasers to radiofrequency to ultrasound. And there are going to be a bunch that I'm not going to go over, but I'll just go over kind of what my common everyday consult is like with patients. And they've kind of gone through different heat-based therapies to talk about the potential damage from them and the potential benefit, and where people kind of, I think, misunderstand, what these heat-based therapies do. So I'll focus mainly on skin tightening ones, but Dan Beherzon loves heat. I did a Birthmark fellowship. That was my second fellowship in New York with Milton Weiner and Teresa O. And we used to treat birthmarks with lasers, a wide variety of lasers. So I had a lot of experience with the physics of it. And part of my job as a fellow at that point was to really research what these lasers were doing. So I've got a big, substantial background in the actual physics of lasers and how they work and how they really interact with the skin. So starting off with the basics in the realm of lasers, if you guys remember your rainbow or looking at like Roy G. Biv, the red, orange, yellow, green, blue, indigo, violet, that's your visible spectrum of light. So light can pass either via, it can come to your eye as a mixed array of light, or it can come as a single direct photon of light. The single direct photons of light are one single color, which means monochromatic, and we classify those, if they're monochromatic in a single beam going forward in its focused energy, that's called laser. Laser is an acronym. So laser energy passes a photon of light, and depending on where you are in this spectrum, in the visible spectrum, you're going to be absorbed by colors. So let's say you want to get rid of tattoos, you can do ruby, alexandrite, Nd:YAG, different types that get absorbed by blue, red, brown, or black pigment. The far end of the spectrum becomes infrared, and then far infrared. And so you get up to water absorption, which is usually above 1400 nanometers. 1400 nanometers and up, you're in the sublative, meaning light energy photons come in from the laser, and they get absorbed by water, clear. And it just gets absorbed by water and doesn't explode the water, it heats the water. That's called sublative. Then you have 1440, 1540, and then you get up to like 2000s. Now you're dealing with ablation, and you have high ablation. This is the erbium-YAG range, 2940. Erbium-YAG is the classic Fraxel that people talk about, and it ablates the superficial layer of the skin, so now you're getting resurfacing. So with these lasers that are in the 1440, 1540, you get denaturation of collagen, and you get coagulative changes, meaning kind of mushes and melts the collagen, and you kind of regenerate it with new fibroblasts that kind of come in and tell your body to restore more. And stretch marks can kind of dense up a little bit. Then you get to 2940 and you're actually resurfacing the superficial skin for pigment, fine lines, wrinkles, things like that. And then you get into far infrared, which is the 10,000 nanometer range, and now you're in the CO2, carbon dioxide laser, which is less ablative but goes deeper. So the larger the wavelength, the deeper a laser can go into the skin. So that's your array of lasers. When you're dealing with that, you're dealing with very superficial stuff still. Even though the CO2 goes deep, it's still superficial, which means you're not tightening the skin unless you're dealing with thin skin like the eyelid. When you're dealing with thick skin, it's such a minimal part of that thick dermis that you're really just resurfacing it, meaning you make this skin smoother, softer, less fine lines, wrinkles, color, things like that. Those generally are less damaging to the deeper tissues because they don't make it through, but they certainly can pass heat through, just like CO2 can go down and actually cause fat loss in the face. So when you're dealing with lasers, you generally get, if any damage, you get pigmentary change, pigmentary loss, hypopigmentation. You can get blistering, you can get different hypertrophic changes from it, or you can get slight amounts of fat loss. So people can get CO2 laser and have fat loss from it. That's pretty rare, but it does happen. So in general, just assume that all those are either treating color, or if you get to erbium and CO2, you're resurfacing. So now looking at the deeper heating therapies, those are ultrasound and radiofrequency. Those are the two main categories of deeper heating treatments that would tighten the skin. The devices that we've had out in the past, we have Ulthera as the classic ultrasound treatment for skin, and the classic radiofrequency was Thermi and Thermage. So Ulthera is now a fairly antiquated device. It's old. It's been around for a very, very long time. It was around when I was in fellowship, and even then we were looking at it wondering, like, why the hell are people using this? So Ulthera, it's a device that does have some efficacy or some benefit on a small percentage of the population that can last past a year, and I'd say maybe 10% of the population in our experience, and maybe 90% of the population either got no result or eventually a negative result. It was very hard to pinpoint. What happens with Ulthera is Ulthera passes ultrasound energy into the skin. It bypasses the dermis and goes down into the subdermis. The subdermis is mainly made up of fat, and then there's the SMAS under it, depending on which area you're in. Down here it's platysma, up here it's SMAS. So when you do it on the neck, you're typically okay. You don't have anything go wrong with Ulthera in the neck. When you do it in the face, Ulthera, a lot can go wrong, and so it's a device that I would advise not using if you have other options. So what happens is the ultrasound energy passes deep to the skin and it targets the subdermis. The subdermis, again, is fat, and if you go a little deeper than that, depending on the depth of the person's own skin, then you end up hitting SMAS. And the theory that people use to support the use of it is to say that, well, it goes in and it actually tightens the SMAS concentrically. I've been in the face thousands of times. I've never seen that to be a physical reality. It's more of a pipe dream. Really what you're seeing with Ulthera is that it does not shrink the SMAS in this direction and lift it like you'd want it to. It shrinks it in that direction. It compresses it. So you lose the hydratory potential of the SMAS because it scars in onto itself. And indeed, you do see that if you're a facelift surgeon and you're in the face over and over again in a deep plane. You see that all the time. So Ulthera has a tendency to shrink the SMAS, shrink the fat layer, and actually go and shrink all the layers together. So there's no separation between layers. Now, what's the downside of that? It'll age you faster because you've lost the soft tissue consistency and kind of resilience of the skin. It gets dehydrated, you'll look drier, you'll look more wrinkled, and you'll throw more shadows on the face as the face slowly deflates. Now, most people don't notice it because it happens 1 year afterwards. So they look good for like 6 months as there's some kind of stiffness or swelling in the skin. And then about a year later, they say, oh, you know, I think it worked for a little bit, but it really went away. And then they're questioning, wondering, you know, did something worse happen to me? I feel like I maybe it accelerated my aging. And they don't know until they come see me and I say, oh, well, you did Ulthera. It's possible that it actually accelerated your aging and you look older now than you would have if you hadn't done it. And they say, oh my God, yes, that's what happened. That's what happened to me. And I feel I can't pinpoint it. I don't know what happened, but my skin's not as bright anymore. And I just feel like I lost some of my youth in my face, or fullness or roundness or anything like that. So that's a very common thing now you see with Ulthera. And it wasn't as common before, either because people weren't as in tune with this stuff, or because beforehand the treatment guidelines or parameters were weaker. They were lower energy, and now people took up the energy because all these superior devices have come out, and they are indeed superior devices that have come out, and people are still using Ulthera, so they say, okay, you know what, let me crank up the energy to get it better. This is a common fallacy or error that's made in skin tightening and lasers, is that you think that the more you damage, the better you get. And this is an error that we learned from years ago when we were doing confluent CO2 laser. Confluent CO2 laser is like a CO2 wand that you go and you put all over the face and you burn the whole face. But tons of people were getting either hypertrophic changes or they were getting hypopigmentation, loss of pigment in the skin. So then we said, okay, you know what, let's not damage everything, let's damage less, go to fractionation. So the whole idea was damage less, let it recover, don't cause as many problems. So increasing the amount of heat you put into someone's face can incrementally make things worse. And that is what's happening with Ulthera, is that you damage beyond the point of repair and you're also scarring things together. Thermage, similar device in terms of its negative effects. So Thermage unfortunately doesn't do much, and so to get it to do something they have to crank up the energy. Now you're just microwaving the face. So that's how you have to think about it, really, to understand what's happening. You're microwaving the face. Everything's kind of just melting. So thermage also tended to make you either give people no result or make them look a little bit older. So how do you go give somebody a positive big result without damaging them? You have to find the sweet spot in all these devices. The sweet spot of denaturation, which means you're going in, breaking up the links in the collagen or the hyaluronic acid, but not completely obliterating it where it can't recover. And the devices that I use, every single time I use them, I know not to use too much. So let's say profound, for example, which I'll go over. The times that I see negative effects or no effects is when the doctor sits there giving more of their time, more of their energy, and they're trying to do more for the patient, and they end up doing 800 passes in the face. Whereas when I do it, I do like 250, and I get great result. They heal normally. They never have any problems. Doing more is not necessarily better. You're actually past the point of benefiting them, and it starts to damage them. So getting into the other radio frequencies, you have the fluff radio frequencies and the real deep radio frequencies. So the real deep radio frequencies are Fractora, Morpheus, which is the newer version of Fractora or the modified version of Fractora, and Profound. Then you have other types of heat devices that use either Nd:YAG or heat fat and those kind of things. I'm not talking about the fat ones. I'm talking about just skin tightening. So you have EndyMed, the older InMode devices, and there's a million other devices that are superficial radio frequencies. Superficial radio frequencies, I call them the fluff ones. The fluff ones are not necessarily bad. That's not why I call them fluff. I say that because it's more of a facial. So microneedling, when you do it in the skin, can stimulate the skin for maybe up to 2 months, and it'll make the skin look a little more radiant from hydration, from your immune system kind of coming in trying to heal the area. You don't really get much in terms of improvement in collagen or anything like that, but it does hydrate you for about 2 months and makes your skin look better. So it's a nice adjunct to facials. If you add in a little electricity to that, which is kind of like the EndyMed, you do get a little bit of improvement from that. So it's a nice thing to do. You do not want to crank up the energy on those devices, nor assume that you'll ever get tightening from it, because it's not real tightening. You'll just get fullness and stimulation and that kind of stuff. There is a device called Plasma Pen, and there's another device called J-Plasma that fall into kind of a weird category. So the Plasma Pen is an electrical pen that burns the skin. And it's nothing new how it works. We use bifurcators all the time, which is a form of cautery, and we have CO2 laser, which isn't where the idea of Plasma Pen came from. Plasma Pen is largely bullshit. I don't mean to say that it's never done anything on anybody, but I have yet to see an impressive before and after result. And you're not going to see an impressive before and after result from somebody who, is a respected facial plastic surgeon, graduated from Columbia University, trained at, top this fellowship and that. You're not going to hear it from that guy. You're going to hear that it has a good result from, maybe the internist who went into injectables and kind of learned on his own and doesn't know much, or the nurse maybe, not that great, and they kind of, use their imagination. They tell you something's good and they believe it's good, and they're not lying to you because they believe it. But realistically, things like Plasma Pen have never, in my experience or my vision, meaning I've never seen it, given any good result. I have seen a lot of bullshit photos, though, tons of photos that people put up with different lighting before and after, or it's swollen from the procedure itself, so all of a sudden the wrinkles in the crow's feet go away because it's swollen. Those are not real tested results. Those are not real at all. So Plasma Pen, I would use it like a bifurcator, meaning if you're using it for small little lesions, it's good. It is by no means anywhere near as safe or effective as a fractionated CO2, which is what it tries to mimic by doing the fractionated columns of damage. These are very broad columns of damage, and it's electricity. It's very different than lasers. Again, these doctors who are doing it, they're not really the ones who are very highly trained, nor do they know physics, nor do they understand thermal relaxation times. Ask them what a thermal relaxation time is, see if they have an answer for you. They'll have no clue. When you do a laser is a very isolated column of heat energy going into the skin with minimal dispersion around it. And the whole reason that the fractionated lasers or the other lasers can work without damaging your skin to any significant extent is that they can damage the skin to the point where 50% of the skin or so can still recover. When you're doing plasma pen, you're spraying electricity there, and you can get to the point where you get hypopigmentation very easily. So again, the damage is much more easily done with that kind of device. Now, I've been sent photos that confuse me as to why are you even asking me this? It's obviously not true. Can a plasma pen give you a lip lift? No, it's not possible, and I know it's not possible because I'm not an idiot. That's why I know it's not possible. Plasma pen, they go, and from what I've seen, people would do plasma pen all the way across here. At the most, the doctor who's doing it would say, you know what, I saw some contracture because of the heat stimulation. In my mind, that's giving a lip lift. And I say, well, that's good. It's a very uneducated way to look at something, but I understand why you saw it that way. Let me correct you by telling you that the plasma pen cannot give you a lip lift in any form or fashion. And to get it to the point that it would contract, you're going to be damaging your SMAS and your dermis substantially before it ever gets to that point. So your damage is going to be much worse than any improvement you can get. So that's your plasma pen. So not that it can't give an improvement, but for it to give an improvement in most areas, you're going to have to damage it to get the improvement, which is not a good idea. So certainly if a doctor says, you know what, you have a couple little lines here, let me just touch it with a plasma pen, or you have a couple dots here on your face, yes, you can do that. That's safe, but what it's being sold at is completely different. So J-plasma, it's a helium-based bovie, more or less. So it's plasma that gets shot out and creates a thermal reaction at the distal end of it. So it's not actually burning anything. That itself can be very effective for fat reduction and skin tightening and things like that. I don't have tons of experience with it myself, but I have seen issues with eschar, meaning kind of burning through the skin before, and I've seen that quite often, or at least more often than you'd expect with a procedure that can be done without doing that, with liposuction or radiofrequency otherwise. So I generally stay away from J-plasma, but I have seen pretty cool results with it. So I'd say in the very good hands, it's a nice device to use and certainly can work, and certainly has different effects in CO2, so it is entirely different. Then we get to the real skin tightening. So the two real skin tightening devices, or three, become Fractora, Morpheus, and Profound. Everybody I've ever met who works for these device companies, other than Profound, they're generally confused as to what the devices are, meaning how to categorize them. The physicist who made them understands, and they know the difference. Surgeons understand and they know the difference, but the 99% of other doctors who use them don't know the difference between monopolar radiofrequency, multipolar radiofrequency, or bipolar radiofrequency. They call them all bipolar radiofrequency because they think for some reason calling it bipolar gives them more credibility. The only true bipolar, which passes energy directly from one electrode to another that gets absorbed between the two electrodes as a circuit, which is a true bipolar, is the Profound. And that has 5 pairs of electrodes that go 20 degrees into the skin, or 70 depending on which handpiece you have, and it can actually sit in the dermis and cause denaturation of the hyaluronic acid, collagen, elastin, everything, and get the most skin tightening or skin thickening you can get out of any of these devices safely. Morpheus is not a true bipolar, but it's a very good device. I only say that because I don't like when people call things, names incorrectly. So it has many electrodes going into it, and it has grounding pads. Grounding pads and many electrodes for us in the surgery world is a monopolar or multipolar with grounding is very different than a bipolar. And if you ask a neurosurgeon will tell you exactly what a bipolar is because they use it all day, every day. So either way, the Morpheus is very effective, and it's an adjustable depth, which means it can go from 1 millimeters to 4 millimeters in depth, and it goes straight down into the skin, and it has insulated needles so it doesn't damage the surface, which is great. However, because it's not a true bipolar, and it's because it doesn't have the thermal coupling that the Profound has, it has to go at a different energy level where you get smaller amounts of improvement at once than the Profound. So Profound you do once, you get a big improvement. Morpheus, maybe 2, 3, 4, 5 times, depends. The benefit of it is it's more versatile of a device. So for people who are buying the device, Morpheus is more versatile. You can use it for superficial stuff, deep stuff. You can get less recovery time, more recovery time. You can play with it a lot more. Fractora is the kind of older school version of it that doesn't have different depths, and you would use generally around the eye to scar the tissue planes together for malar edema or something like that. So either way, those are your real devices. Become Morpheus and Profound. I like them both. They work really, really well for skin tightening, actual skin tightening. And actual skin tightening means heavy folds. If you can get heavy folds to diminish in their appearance, that's actual skin tightening. CO2 doesn't do that unless you burn someone's face off. Chemical peels can, but that's usually on thin, light, white skin where you can see the surface area kind of improve just with doing a chemical peel. Those are the main ones. There's also wand-based devices, which are Thermi RF, kind of like the J Plasma, face tight, body tight, and there's a couple more. So the wand-based devices, what they do is you make a small poke hole, you pass it into the neck, and you go reduce the fat while getting skin tightening at the same time. The downside of a device like Thermi RF is that you have to watch an RF monitor the whole time. Anywhere you have room for error and you have to really compensate for that by staring at a monitor, errors can happen. So for that reason, I think it's exhausting mentally to do these things, and I don't think it's a great idea for a doctor, if they're going to purchase a device, to purchase Thermi RF when they can buy FaceTite, and they can do it without monitoring because the monitor is automatic on that. So Thermi RF, things can go wrong, but if the doctor's good, it's a great device for that. Never put that in the face. Okay. Then you have the other part of the platform of Morpheus, which is the Embrace platform. Comes also with the FaceTite, AccuTite, BodyTite. These are wand-based devices. AccuTite's a tiny one, FaceTite's this size, BodyTite's bigger. FaceTite should not go in the face in general. So FaceTite's called FaceTite, but it should be called NeckTite because it shouldn't really go in the face. Heat-based device going in the face is going to heat and melt your tissue planes. It can damage your muscle, it can cause indentations, it can cause dimpling to occur, and it can overall change the dimples and the shadows that you see when you smile. So I would advise people, unless you have some really specific use for it, meaning, you know, it's somebody added fat to this one area, I can't liposuction it out, I want to melt it, sure, use the FaceTite in the face. Otherwise, don't use the FaceTite in the face. It's going to cause more problems than good. I'm sure of that. It's better to use Morpheus in the face or use Profound in the face. Do not use FaceTite in the face. People use it on the jawline here. That's fine. Once you get above the jawline, again, you get into trouble territory with nerves. And the reason they go up here is because they think that they can shrink the jowl. It is erroneous to think that the jowl is a pocket of fat. It is not a pocket of fat. The jowl occurs from density in these ligaments here, density here, density here, and as the face sags like a pendulum, it comes and causes a jowling here, a gathering of soft tissue. It's not just fat, it's fat, muscle, nerves, artery. There's a bunch of stuff that are in there. So you can't just go liposuction that area and get rid of a jowl. However, you certainly can do liposuction or jawline contouring just at the base of the jowl, and that's totally fine. So don't put Kybella in the jowls. Don't try to liposuction the jowls. Those things don't really work. They cause weird little jawline contour irregularities. So the takeaway from that is be very careful with wand-based devices and use them only in the neck with few exceptions. So again, AccuTite, which is the little one, sure, you can use for tiny little pockets here and there. It doesn't generally work for tightening the nasolabial fold. It melts it and makes it broader a lot of the time from what I've seen, so I'd be cautious about that. My favorite that I use repeatedly, and especially if I'm dealing with like actors, actresses, people on film who cannot risk doing anything that's going to be seen up close, I like doing Profound. It's super safe. They can also do Morpheus. It's super safe, but I would never allow them to do like a liposuction in the face or a wand-based device in the face. That's something that it really takes an expert to be good at, the liposuction in the face. Very, 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 very difficult to be good at that. I am not good enough to do that. So I'm sure there are a few people, but I'm not good enough to do that. And certainly would never put a heat wand in the face, would never put Kybella in the face. Not never, but almost never. So all my nevers are with rare exception. So that's the, I'd say, general gist of heat-based devices. I may have missed a lot, but I talk about this stuff every day, and I try to guide people as to what the difference is between the types. And certainly I can go into a greater extent with diagrams and things like that, but this was just to answer a lot of the questions I've been getting recently from patients. They've been sending in questions about Ulthera and things like that a lot. Most people send in questions about Ulthera. Yes, Ultherapy is the same as Ulthera. So hopefully that was great. Thanks, Mom. hope it was wonderful information, and I'm going to go finish with my last couple patients.